had patients who have tibial nerve injury who have a hard time unlocking their knees. And it's probably because they've lost the popliteus. So just put it back there somewhere. If somebody says, what are the one joint knee flexors? What would you answer? Biceps femoris, yeah. So it is a one joint knee flexor. It probably is important in unlocking. Now, I've also stuck in here the gastrocnemius. It comes from two heads, medial and lateral condyles of the femur, to the calcaneus by way of the Achilles tendon. Okay? It is a plantar flexor with another muscle called the soleus. Okay? But it also is a knee flexor. If you are standing with your knee locked, the moment arm of the gastrocnemius is almost zero for flexing. But as soon as I flex my knee, I'm increasing the moment arm. And therefore it becomes a powerful knee flexor. So that if I want to come up on my toes for some reason, and I got my knee extended, I could use the soleus, that should come next week, and the gastrocnemius. But as soon as I flex my knees, if I try to come up, I have to use a whole lot more quadriceps to keep my knee extended if I use the gastrocnemius. Now, why, other than that, why introduce the gastrocnemius at this point in time? He answered rhetorically, and will answer. If you have a contracture of the gastrocnemius, it's going to make it very difficult to walk because it's wanting to flex the knee. And those of you who have some reason to work with children, God love you, you're going to have people, have children with tight heel cords, and that's going to have an effect on the function of the knee. I also mentioned, just so I mentioned it, and most people forget it, there's another muscle called the plantaris. It's a small muscle that acts like the gastrocnemius, and who cares? Because the sucker tears fairly often, and you may have pain that you can't really quite identify. Consider if it was a traumatic injury that they tore the plantaris, and it's a pain, it's a muscle that hurts that we never talk about.
Where would that pain be?
Either up near the knee at its proximal attachment, or sort of somewhere along the muscle belly of the gastrocnemius.
Because of the tendon tearing? So does the muscle tear or the tendon?
Well, you might get a sprain, or you might get a strain. It could be just the attachment. You know, a muscle can hurt about anywhere.
Right.
One of my students, who was sort of an intriguing student, not because of the student, because of the mother, I consider her judgment questionable, but she was out water skiing, and you know, you let go of the rope, and you sort of, she let go of the rope, but she was way too close to the pier, and she was heading toward the pier, and she turned and tried to stop, but she didn't make it. And she was a great case study, actually, on hamstring tears, because she tore a lot of the hamstrings when she hit that pier. Okay, that was sort of funny. here a thing called the knee complex, which was a review only. It doesn't contain everything it's supposed to do, and it's sort of the things to think about, running over it. Consists of two joints, tibial-femoral, and patellofemoral, modified hinge joint, the screw-home mechanism. Remember, in non-weight bearing, the tibia rotates laterally. In weight bearing, the tibia can't rotate, so the femur rotates medially to lock the knee. Flexion, the patella sinks into the tibial-femoral joint. Full extension, the patella must move out of the joint. Clinically, why is this significant? If you have a patient with a knee flexion contracture greater than 10 or 15 degrees, you cannot, you may not, you should never, ever, 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 ever try to pull that patient's knee into extension unless the patella comes out of the joint. Because what you got then is the patella in there serving as a wedge, and you're pulling the tibia away from the femur. Do not stretch. If you're going to stretch it, you might as well notify your malpractice insurance company before you start doing that. Capsular pattern represents more or less more flexion than extension. Most open pack position, 25 to 35 degrees of flexion, which is the position that a complete joint effusion will produce. That's where it'll be stuck. If it's stuck there, do not try to stretch it until you get the fluid level down. One of the intriguing things is you can have a patient with late-stage osteoarthritis, and they have hugely swollen joints, but you can take them into full extension. You'll see the fluid pouch out around it, and the fun thing to do is tap it on one side and see if the ripples come out the other side. If they come out the other side, you know that the joint capsule is incomplete. That's the only reason those patients can fully extend their knees, because they've torn up the joint capsule. Okay? We've mentioned quadriceps, etc. Okay, vastus medialis obliquus. Last thing, I think. The vastus lateralis is in a position that it is functionally stronger than the vastus medialis. I don't think it's in there, I just wrote a note for myself. So that when the knee extends, the lateralis is pulling the patella laterally out of the track. The medialis can't overcome that. Fortunately, since I was a little PT, we've grown another muscle, because when I was a little PT, we didn't talk about it. There are a few oblique fibers at the distal portion of the vastus medialis, and this is now its own muscle called the vastus medialis obliquus, and its job is to keep the patella tracking properly. Sometimes that part of the muscle will get weaker, and you'll have lateral tracking problems, and they'll want to do a total knee replacement, or at least do major surgery in there, but that should not be done until attempts are made to strengthen that part of the muscle. And just give you a clue, you exercise internal knee extension. If you want to, you can stick an electrical stimulator on there and stimulate those fibers, etc. But you work in total knee extension, so you're doing short arc exercises, your total knee extension, and in, I don't know if you still use Kisner's book or not, whatever book in there should give you specific exercises to do. Okay, questions? Otherwise, we're going to do a lab activity. Let's take, yeah.
You said the joint capsule is incomplete. Can the joint capsule ever become complete again? Or is it torn? Once it's torn, is it torn for good?
No, these folks are heading for a total knee replacement, or at least clearing it out. So No, that's gonna keep happening until they're given a new joint. When does a patient need a total knee replacement?
Yeah. They can no longer function without
When he
compensation.
decides.
And the pain is great.
Yeah, I've had them wait 10 years and then complain, why didn't they make me get it sooner? Well, it was your decision. Some people just say, I never want one. And if you have one that goes bad, then you're darn sure you don't want the others. Okay, 10-minute break, and then please go find us a couple steps or stools or something. There used to be some around here somewhere.
Back to